call and say, hey, I think we have the best plan for you, and they just change it without even knowing. And then by the time you look, they have no medications coming in because their out of pocket is like $500. Like, they'll be on an insurance plan, but as I say, sometimes they only get probably like say $500 as disability money, like, and so that is just not enough. They can probably pay their rent. Some days some are not eating any food, they're not eating, or probably they're eating every other day or something like that. So the $500 that they're getting is not enough, and then they have an insurance plan that they will get some money back on. Like, say for example, some insurance will give you like $100 back on your per month on a card that you can use for like anything like prescription foods or anything like that. But then some of the plans that are out there, patients are on them, and now I realize some of them, their benefits have been canceled, and they get upset about it because they probably get enrolled with a different insurance to kind of help with to kind of help with getting back some money. But then it's like you're getting back $100, and then they would have normally had their medications covered, but then probably one medication is not going to be covered on a specific plan, and probably somebody reach out to that person and be like, okay, then, well, I can get you back $100 in your pocket per month. Just imagine somebody who is making or getting $500 in disability. Those persons will definitely want to get back $100, but they're not understanding that, some of these persons that are selling the insurance are selling it, and it's benefiting them as the person who is selling it, the insurance itself. And the patient is going to have to give up one or two things. Either they're going to have to give up, one medication or two medication in order to get back $100, or they're going to have to do or it's a case where they will definitely have to pay an extra $10 to get back $100. So there's always some twist to it. So now you find out that a lot of patients, their insurance plan, they're changing it, but then some of the benefits that they normally have, they don't have it anymore. And so that is causing problem, because a lot of persons who were on like home health services, their services actually discontinued because they change a plan. Some of them, they're not really thinking straight, and so they just go by whatever somebody call and say, hey, I think we have the best plan for you, and they just change it without even knowing. And then by the time you look, they have no medications coming in because their out of pocket is like $500. The other day I had a patient, it's a renal patient, and this lady, she was supposed to get her hydralazine and amlodipine. She's on dialysis, and we weren't able to get her medication. So I called the pharmacy, and they were like, yeah, her medication is going to cost $150. Her out of pocket is, I think it was like $600 and something. So I called another pharmacy to find out, and it was the same story. So I don't know. And this lady, she has had her medications going perfectly fine throughout the year. Now she switched over, and it's like a total mess. So that's another thing that we find, persons, yes, are sending them information or selling them information, and because of their situation where they need money, they're not thinking about the fact that the medications that you have right now, or the plan that you have right now, is better for you. And so they go ahead and run with getting $100 or saving $10 in order to, to continue with whatever they're doing. And then in the end, it just messes up their entire thing. But yeah, Claudette Miller, thank you so much everyone for tuning in. If you haven't double tap the screen, remember to do so. Thank you. And then Claudette Olivier, hi, thank you so much for tuning in, Claudette. Thank you so much. Do not take managed Medicare. If you are on straight Medicare, please keep it. Exactly. I don't really know much about the Medicare, the Medicare, the different plans, but I know a little bit, just a little bit to kind of talk about it, but a little bit about it, but you know, I realize that I always tell the patients, like, you know, if you are on something for years and it's working for you, don't change it. You know, don't change it. Find out, have a family member or somebody else, try to get some more information, because then if you're going to be changing it, you're not going to, you know, benefit from the same thing that you were getting in the earlier in the year. And that is one of the biggest thing we have. You know, they're switching just because they want to save something and then messing up their plan. Hi Jason Latif, thank you so much for tuning in. Oh, thank you so much for tuning in. All right. Claudette Olivia, are you a home health nurse? So I do house calls as a nurse practitioner. She says that the situation would probably involve social workers. So yes. So because I don't really go into the office, I do send out information, you know, like whenever I see things like this, for them to try and get in contact with them. But sometimes it takes like weeks before, you know, they hear anything. And then the other challenge is that sometimes these patients don't have any phones, you know. They don't have any phones to have like follow up with them, because a lot of times, especially the patients I visit like some patients, I do visit them once a month, and that is not something that I do get paid for if I do visit them and they're not there. But sometimes I'll have a few patients that I definitely will just drive to their house because I cannot get through to them. Like, say for example, last month I tried reaching out to them, I cannot get through. I will definitely, you know, go to their house and see if they're there. And I realized that a lot of these patients, they don't have cell phones. That's the other challenge. So even if we have social worker, you know, trying to reach out with them, we have psych trying to reach out with them, because especially with psych, you know, we don't have that much of a mental, we don't have so much mental health providers, you know, going in the home. So a lot of times they will do virtual visits for a few of these patients. And what I realize is that sometimes the visits are not even possible. They can't even talk to them, can't confirm an appointment, because, you know, they don't have a cell phone. So a lot of times I will just definitely just drive down, see what's happening, hear what's happening, and then from there. But yeah, that's the other challenge. A lot of these patients don't have cell phones, and that's just it. You're not going to find like a psych provider just driving to a house and, you know, hoping to find a patient, because a lot of times I drive down to see the patients and they're not there. I'm not getting paid for that. So I try to, you know, bundle those patients throughout the month, and then I'll just drive around, see who I can find. If I can't find them, then, you know, but whoever I can find, I get a chance to do an assessment, hear what's happening, and then from there. So yeah. So Kevin B8, love the accent, remember me? No, don't remember you, Kevin. I think I remember your name popping up on the screen. Yeah, but thank you so much for tuning in. Remember to go ahead and double tap, you know, double tap the screen here. Yeah, so that's why I want to, if you haven't heard or watched the other video where, you know, I said I need help. Yes, it's to kind of help with some of these patients, because a lot of the patients, like as I say, you know, they don't have, some of them are not eating, or if they do eat, it's probably like 1 meal per day. So what I'm trying to do is, you know, do a little 1 or 2 things, like, you know, providing tin items or toiletries or something for these people that I visit. And as I say, most of the time I deal with the elderly population, so a lot of times they do need the help there. So yeah, but there's so much work out there to do, like, you know, there's so much work out there to do for these elderly people. That's why, you know, even though we talk every day about, you know, how bad it is in some places for nurses, you know, a lot of times, even though we might share our story, it doesn't necessarily depict the entire or the general, you know, picture when it comes on to healthcare, you know, providers or facilities hospitals is not that. So I don't want it to be a case where people are like discouraged about coming into healthcare, going into nursing, going into home health. If you, as I say, if it is something that you definitely want to do, go in there and do your best, give your best, because there's work.